Great. So, Gina, Michael, I appreciate you jumping on today's video call. I invited both of you because of your expertise and background in this relevant area. I think, today's video is just a quick opportunity, a snapshot for an employer to kind of look at some of the key statistics that are relevant in this topic. We can go over some of the key drivers of unnecessary ER visits, and then we can look at one or two solutions that an employer can consider as they're looking to really try to make some edits and some management edits to try to drive down costs and manage costs. But why don't we start with some introductions? Gina and Michael, if you want to kind of introduce yourselves and give us a little bit of your background, and then we can go right into some of the data.
Sure. My name's Gina Roybal, and I'm an account executive. I have been in the medical industry for over 30 years. Started out managing neurosurgeons, 12 of them in the San Gabriel Valley, and went through the gamut all the way from insurance carrier, Anthem in Orange County, all the way through brokerage. So very familiar with employer group benefits across all lines, medical, dental, vision, ancillary lines, etc.
Great. Michael?
Hi there, Michael Van Gilder. My former life, I was CEO and owner of a Denver-based insurance brokerage firm. At our peak, we were 10 offices in 6 states. We sold roughly 8 years ago. And spring of last year, I joined the founder of Amaze, David Silverstein, to help him scale Amaze. We rolled Amaze out. Amaze is a 10-year buildup of some medical frustrations on behalf of David Silverstein, and he turned a for-profit company, Amaze, and rolled it out in February of 2020, right as COVID started. So we really got some traction last year. Today we have roughly 40,000 subscribers and rapidly growing.
Fantastic. I appreciate those introductions. Well, healthcare costs are obviously increasing, and we could spend an hour just kind of sifting through some of the reasons for that. But let's just kind of focus on ER visits and unnecessary ER visits and what's driving that and some of the key statistics behind that. But I think the thing that kind of jumps out at me is the national average is about $2,200 to walk into the ER visit, and that's before imaging, and I think it's higher in California. So, I mean, that's staggering amount of money for an ER visit, especially if it's unnecessary. Kaiser Family Foundation is a very credible resource in terms of their research, a 20-year study. So this is before COVID, and I think that's relevant. A broad swath of America, 44 states. So they found that, the utilization rate at about 43.7% and CDC about 40%. So we're kind of in that 40 to 43% utilization. Anybody surprised by the frequency?
No, I think much of that is driven by individuals' lack of primary care and just none of us grew up with the life skills of navigating our healthcare system, and so our default in an emergency or perceived emergency is to do just that, go to the emergency room, which is the most costly place you can go. Exactly.
So, 500 covered lives, you might anticipate 200 ER visits a year. That's, it's staggering when you look at the costs and the impact, to the families, the time, and to the organization offering those benefits. But, let's look at, and there are probably many different reasons for unnecessary ER visits. But, Gina, if you could talk about these three, because we talked about that the other day, and just kind of, illuminate us a little bit about these three particular drivers.
Absolutely. Very similar to what Michael was just mentioning. Our health insurance industry is incredibly challenging to navigate through. It is not an easy healthcare system end user, meaning I'm a patient, a member obtaining care. On an HMO level, specifically in California, you've got to be assigned a primary care physician and a medical group for assignment outside of the Kaiser environment. If you haven't seen that physician or communicated with that physician, there is no relationship. So to you, your only point of contact in the middle of the night when you have that horrible ear pain and you don't know what it's from is to rush yourself to the emergency room. You do that based upon the fact that there is no other relationship you have to be able to communicate. You don't realize there's urgent care environments. You don't realize there's an amaze. You don't realize that there's anything that's available outside of the traditional format of medicine. That is a very strong contributing factor to ER visits being at high utilization. The other piece that's very important is our emergency rooms have really become primary care facilities, and they're not to be primary care facilities. The reason why we have primary doctors, internal medicine, general practitioners, is to treat those basic dysfunctions in our humanity and our human body. When you use the emergency room for those services, you've clogged up the true system that's available for those that truly need that emergency level of service. So colds and flus versus strokes and heart attacks, obviously a very grave difference in healthcare. COVID also allowed that to continue to broaden the disparity because COVID stopped having in-person doctor office visits for our primary care physicians. So then it went to a telemedicine type of environment, which is wonderful. However, it's generational as well. You have certain patients that only want to see doctors in the white coat in the office. You have others that only want to do a FaceTime or a telephonic in-person conversation. So that delayed and pushed a lot of people to the emergency room because the only thing that was open is your emergency room. And then, of course, as we know, our employer groups are required to cost save through healthcare. So what they've chosen to do is purchase health savings account plans for their employees with no contribution. So that means everything is subject to deductible. My primary care physician, my emergency room, any level of care goes to my deductible first, which is first dollar to the employee, which is obviously another reason why there's staggering issues in regards to accessibility to care, access to care, and then certainly the cost of that healthcare.
Yeah, I agree that the relationship between the primary doctor is lacking a lot of times, and if you don't have that comfort level, that trust, and that kind of that muscle memory to in my case call Dr. Globus, you're going to fall back on kind of what's comfortable and what you've done in the past. Well, Michael, I heard about the statistics and these cost savings associated with your organization out of Northern Colorado. The data was compelling, and it's one of the reasons I wanted you to kind of come in and be able to explain that. So if you can kind of give us a little insight on this data.
You bet. And when you reference Northern Colorado, there's a specific insurance broker that has probably 40 clients with Amaze Health, and so he's doing a lot more tracking than others, but I'm going to speak even more broadly than that. And let me back up for a minute. We find that savings and moving away from emergency rooms and urgent care rooms are a function of utilization of your program. So those employees that are using Amaze Health are the ones that are having the biggest benefit from. We're seeing a 50% reduction in emergency room visits. We are seeing a 70% reduction in urgent care visits. In fact, we're starting to develop stronger data. Cigna, in fact, mentioned that those clients that are with Amaze Health are seeing a 40 to 50% below norm on emergency room visits, and again, a 70% reduction in urgent care. So these are coming from third parties, not just our data points.
Well, I have to say from personal experience. I had an eye condition that was pretty alarming when you looked in the mirror. But from really the comfort of my couch, I called, kind of wanted to test out the efficiency. But within really 30 seconds, I was connected to a provider, and they looked at my eye and kind of reassured me and gave me a plan of care. They followed up within 2 weeks, but the thought of having to go to Dr. Globus or an urgent care, spending at least an hour waiting, the time and an expense, versus being able to do it in my house, I think as patients and employees start to feel the difference, the efficiencies and the savings, you'll get more and more utilization. But just from personal experience, it was super efficient. So I was glad to be able to take advantage of it. Gina, we talked about stepped actions and how you can kind of make some edits to a self-funded plan and create some efficiencies that shape behavior for everybody's benefit. Can you outline that a little bit?
Absolutely. So self-insured plans are policies and plans that are put together where the first claim dollar comes to the employer, but you're able to design your plans appropriately by the plans you'd like. So you can take statistical values such as your emergency room visits, your pharmacy benefits, and you can modify those plans to work for the betterment of your population. So we'll use as an example a step therapy for your pharmacy benefits. Right now, our formularies are pretty large and available through all CVS, Marks, things of that nature. But it might be on a self-insured plan that you wanted to go ahead and say you have to take generic format first before you're able to get to brand name or brand name non-formulary. That helps cost reduction, but it also helps education for the employee population. Because as we all know, when we walk into a doctor's office, whether it's virtual or whether it's in person, the first thing that physician is doing is immediately extracting out his prescription pad and writing 8 prescriptions to go forth, which perhaps out of that 8 prescriptions, you didn't even need 1. However, you as a patient don't realize what happens. You immediately go to the pharmacy, pick up your prescriptions, and now you've cost the health plan for a prescription that you're going to place onto your medicine cabinet and never touch or take. There are several different levels based upon how you can administrate. But one of the things I think is so important, such as with Amaze, is education to the employee population is the most critical factor, whether it's self-funded insured plans, using an Amaze product, or basically fundamentally administrating your healthcare within our difficult navigation of healthcare environment. So many different ways of doing things. But the first thing you want to do is look at your analytical data. Where am I looking at? What am I looking at in regards to clinical information? Do I want to influx wellness programs? Do I want to take step therapy programs for pharmacy benefits? Do I want to remove that all back and place a little bit more of a holistic format of medicine into the equation versus emergency room, pharmacy drugs, and continued care that really doesn't give anybody a resolution to the ailment at hand?
Well, you bring up the idea of education. I tell you from real life experience, my wife's preparing for 2 total knees. So I know exactly. So we approached Amaze, went to their orthopedic specialist, and outlined and had a conversation with them for about 30 minutes and described what was going on. She helped us identify 3 or 4 physicians in our community, ones that had 200 plus surgeries a year, fellowship trained, all the key areas that are relevant. Looked at our Anthem plan, so we knew what to expect. We're doing some tactics to prevent any out-of-network charges, and just things that help us as a family, but also kind of protect the plan, right? So I would say altogether about an hour and 15 minutes of virtual education through the platform as we prepare for these 2 major surgeries. So education is key. We get educated up. It helps us as a consumer of healthcare, but it also helps the organization become better consumers of healthcare. And we say within our agency here, let's go to the virtual platform first. And if we need to go out and go to Dr. Cohen's or other types of specialists, et cetera, at least we know what to ask, what to look out for, what to prevent. And it makes that experience a little less overwhelming, a little less trepidation as we go through the process. So I concur that education and that insight is very important. Again, thanks for jumping on today's call. I think again this was designed to provide a quick snapshot, some insight to the issue. Very tight one in terms of the ER visits, but Michael, you brought up some broader information that I think is relevant. Some solutions that employers can consider, and I'd love to do some additional videos in the future that we can tackle some different topics. But again, thank you for today's call.
Yeah, John, let me just one more, I'll call it a Amaze commercial, if I may.
Sure.
We talked about the many point solutions that are out there: EAP programs, telemedicine, mental health, workers' comp triage, which is not directly, of course, health insurance, price shopping tools and wellness program. Companies can get rid of all those and simply buy Amaze, because Amaze does all of that. And that is frankly a driving factor of why we have, trending towards 50% utilization of the employee base versus these point solutions I mentioned having under 5%. And let me highlight one of these, which is perhaps the biggest issue out there today in our country, and that's mental health. So traditionally, not Amaze, you call you go to your HR director, they might send you to your EAP program, or you call your primary doctor. And what will happen, and this is when you're having that hot moment. Let's just say it's a stay-at-home mom with some troubled kids, and she's in need of speaking to somebody. She doesn't need to speak to somebody in a week when she can get an appointment. She needs to speak to somebody right now. When someone calls Amaze with a mental health issue, within 15 minutes they're connected to our mental health therapist, who is a W-2 employee of ours, and they will take them through a process then and there, bring them down from their point of urgency. And if that individual is not someone that needs persistent mental health care, we'll schedule follow-up meetings with that person. And of course, if someone has, that's clear they need consistent care, then we will find a therapist for them. But we are there first and foremost when they have that moment of need. So I'll leave it at that. Thank you.
You bet. Now, you bring up a point. We do have a mental health crisis. There are multiple examples. I've spoken to families that have tried to find a provider. They're either filled, they're retiring. You have swaths of America where you have this mental health desert, they call it. So to have someone available with a click of a button that can address your crisis, your issues, and really kind of address your anxiety and depression and put you on a path, I think it's invaluable. You go to any newspaper, we definitely are in a mental health crisis. So I think you fill a significant need with this platform. Again, Gina, Michael, I appreciate the time that you carved out for this call today. The information was insightful and hopefully useful for the employers who will view this in the future. But let's do some more videos in the future. But thank you again for today's call.